Campus Medical Waste Services has already started training its staff, and for more on this, I'm joined in studio by the company's Health and Safety Coordinator, Thembi Cele. Ms. Cele, thank you very much for joining us this morning. So, what kind of training are you giving your staff members?
Okay. Firstly, we have an SOP, which is a standard operating procedure regarding management of isolation waste. That's the first thing. And then we've trained them also on how to handle the isolation waste. So basically, we do a toolbox talk. A toolbox talk, it's merely training, which is nearly like 5 minutes, just to train employees on how the coronavirus is transmitted and how to wear the PPE. PPE is personal protective equipment. And
let's talk about the medical waste that your employees therefore will be handling.
Yes.
What kind of waste are we talking about, and how do they safely dispose of it?
Okay. Firstly, the procedure, the waste that we handle, it's healthcare risk waste, meaning it's healthcare waste that is generated by healthcare facilities, be it your hospitals, your clinics, it can be your infectious, your shops, your anatomicals, etc. So what we do in case there is an outbreak or an isolation of that kind of waste, firstly, the facility must inform us to tell us that there is a confirmed or a suspected case. Okay, so on that note, what we do, we have a designated vehicle which we have to handle that waste. Our employees are trained, distribution employees. They have to sign a consent form to agree that they are willing to collect that type of waste. From there, we have special kit, especially for isolation waste, which is always readily available in the warehouse.
Where is that waste taken, therefore?
It is taken to an incineration plant. Our subcontractor...
So it gets burnt down?
It gets burnt down.
What happens in a case where there is mishandling of such waste? What could the possible impact be?
Okay. Firstly, our employees are not allowed to take any waste that is not prepared. So initially, when our drivers are wearing their personal protective equipment, they have to fetch the waste outside the isolation ward, already prepared. By preparing, I mean it has to be in a 142-litre box set, which is a single use, and it must be double bagged.
You are a service provider that is going to be working with these hospitals that are designated to handle patients of this virus, should there be an outbreak in the country. How many hospitals are you allocated or have been allocated to you?
We have an excess of 3,400 hospitals that we render services with. So currently, as part of my duties, I do audits as well in the hospitals. For example, from January up until now, since the outbreak ran through, I did audits especially focusing on the isolation wards, if they are equipped enough to handle this type of case.
I'm going to use a hypothetical example. With the Ebola virus,
yes,
people who died of the Ebola virus and would have been watching documentaries, the handling of their bodies was such a sensitive issue that I can't tell you what it was that made me think that, gee whiz, are these people handled as part of medical waste now, or are they still, people that belong to their families, and therefore their families are going to have to be allowed to bury them? Are you involved when it comes to such matters? And the reason I'm using the Ebola virus is because of just how sensitive the issue was.
It is. Okay. Basically, our company, which is Campus Medical Waste Services, we do not handle bodies. We basically handle waste, healthcare risk waste, but not bodies. So by healthcare risk waste, as I said, it's infectious. Be it your soiled bandages, your shops, which maybe they were administering the patients, etc. But bodies, we do not handle.
I see. And you have no knowledge of how this would be handled if we had to have such an eventuality in the country?
Okay. Department of Health will advise on that matter.
Okay. All right, Thembi Cele, thank you very much for your time. She is with the company that is going to be handling or working with hospitals to handle the hazardous waste should there be an outbreak of coronavirus in the country. On to